As advanced as medicine has become, it's still guesswork to a large degree as doctors try to figure out how a patient will respond to a particular treatment.
But as you'll see in tonight's Buckley Report, that may all be changing as the promises of what we can do now that we know how to map everyone's genome are paying off.
You wouldn't have seen something like this in a hospital 10 years ago.
No.
Your healthcare is changing.
This is something different, this kitchen.
It is.
Cooking with a cardiologist?
Absolutely. Yes.
And it's about to get very personal.
And we believe also looking at lifestyle medicine in a very different way and having the opportunities for our cardiologists to be in the kitchen with patients and with community members.
Cone Health has a teaching kitchen at their new facility in Greensboro.
In which, as we were talking about, making the right health choices.
But that's just a small part of a much bigger initiative.
I think people are actually excited about it.
It's one of the most exciting technologies and one of the most exciting times in medicine.
James Liu spent time on the research faculty at Duke and at the National Institutes of Health before being one of the founders of Helix, a genomics company that is now working with Cone Health to map the genomes of 100,000 people in the triad.
The sun's just coming up on DNA science.
100%. I think this is, if you're in a baseball game, we're just getting warmed up, right? A little bit first innings or early part of the first innings.
Cone Health is providing the gene mapping for free to anyone who volunteers to have it done.
You'll collect as much DNA as you can, and then what?
That's right. I think the broader heading of this has often been precision health or precision medicine, and that's how we've been talking about it. But it's really around right diagnosis, right treatment to the right patient at the right time. And the other way people often talk about in medicine is improve the health outcomes, improve the patient experience, lower the total cost of care. And so precision medicine helps solve all those different pieces, right? If you can get better targeting, better treatment using DNA, you're going to be able to treat the patients better at much faster rates and effectively a much lower cost.
What we're doing here is learning how to give every individual their individual health care.
Absolutely. Think about banking. Banking is very personalized now. If you think about the apps, the widgets that you want to see, very personalized. If you think about that. If you think about shopping, same thing, very personalized in that regard.
What they'd learned back in that new teaching kitchen at Cone Health is the part that most people can grasp easily.
Like as a basic resident up the road, I can come in for classes?
You can sign up for classes, yeah, several times a week.
They cost money?
Very minimal, if any.
The science of using your gene map to design healthcare unique to you can be tougher for a lot of us to truly get.
While the typical consumer or patient may not have the full understanding, they can see the outcomes. More birthdays, more anniversaries, more celebrations with the family, and you're feeling good about being there. That's what this is about.
The future of medicine has arrived. Bob Buckley, Fox 8 News.
Now, the main genetic markers the testing will look for at the beginning are for breast, ovarian, and colon cancers, as well as high cholesterol issues. They'll look to start signing up patients later this year.
Progress